There are signs, subtle changes that happen in a loved one's final year that many families miss until they look back. Understanding these signs isn't about giving up hope, it's about giving the gift of presence, making the most of precious time, and ensuring your loved one receives the comfort and care they deserve. Today I'm sharing 5 signs that often appear in a senior's last year of life. This information comes from hospice professionals, medical research, and the experiences of countless families. If you're caring for an aging parent or loved one, this video might be one of the most important you watch. Welcome to Seniors Health Insights. I know this is a difficult topic. Death is something many of us avoid talking about, but that silence often leaves families unprepared for what's coming. When we don't recognize the signs, we miss opportunities to have meaningful conversations, to express love, to seek comfort care, and to simply be present. The signs I'm sharing today are based on medical observation and end-of-life expertise. Not every senior will show all of these signs, and having 1 or 2 doesn't necessarily mean the end is near. But when you see multiple signs appearing together, especially in someone with serious health conditions, it's important to pay attention. This knowledge isn't meant to frighten you. It's meant to prepare you, to help you provide better care, and most importantly, to help you treasure the time you have. Let's approach this with open hearts. Sign 1. Significant withdrawal from social activities. The first sign is a marked withdrawal from social activities and relationships. Now, we all know that as people age, they might slow down a bit or prefer quieter activities. That's normal aging. What I'm talking about is different. It's a noticeable pulling away from things and people they previously enjoyed. Someone who loved their weekly card game with friends suddenly doesn't want to go. A grandmother who cherished visits with grandchildren seems disinterested or withdrawn during visits. They stop making plans for the future. They decline invitations to family gatherings they would have attended before. This withdrawal often happens because the person is experiencing a natural shift in focus. Their energy is limited, and they're instinctively conserving it. They may also be processing their own mortality in ways they can't or don't want to articulate. What you might notice: they spend more time alone in their room. Conversations become shorter. They seem distant even when you're sitting right next to them. Phone calls they use to initiate stop happening. Here's what's important to understand. This isn't rejection of you or your love. It's a turning inward that's part of the natural process. Some experts call it letting go or preparing to leave. How to respond: don't force interaction, but do maintain gentle presence. Sit quietly with them. Hold their hand. Let them know you're there without demanding engagement. Sometimes just being in the same room. Reading while they rest is the greatest gift you can give. Sign 2. Dramatic changes in appetite and weight loss. The second sign is significant changes in appetite, often leading to noticeable weight loss. In the final year of life, many seniors experience what's called anorexia of aging, but it's more pronounced and persistent than typical age-related appetite changes. You might see them eating only a few bites at meals, when they used to finish their plate. Foods they once loved no longer appeal to them. They might complain that nothing tastes good anymore, or that they feel full after just a small amount. The weight loss can be striking: 10, 20, even 30 pounds or more over several months. Their clothes hang loose. Their face becomes gaunt. Muscle mass decreases noticeably. This happens for several reasons. The body's metabolism changes as it begins shutting down. Chronic illnesses affect digestion and appetite. Medications can change taste perception. And on a deeper level, the body simply needs less fuel when it's winding down. Many families struggle with this. We associate food with love and care, so when our loved one won't eat, we feel helpless. We might try to push food to coax them to make their favorites. Here's what you need to know. Forced feeding at this stage often causes more distress than comfort. The body isn't asking for food in the same way anymore. What to do instead: offer small portions of favorite foods. Focus on quality over quantity. If they want ice cream for breakfast, let them have ice cream. Provide moistened foods or smoothies if swallowing becomes difficult. Keep them hydrated, that's more important than food intake. And most crucially, sit with them during mealtimes. Your presence matters more than the meal. On a 3, increased sleeping and fatigue. The third sign is a dramatic increase in sleeping and profound fatigue. We're not talking about needing an afternoon nap. We're talking about someone who sleeps 12, 14, 16 hours a day or more. someone who struggles to stay awake during conversations, someone whose waking hours become shorter and shorter. They might sleep through visits from family members. They doze off mid-sentence. Getting them up and dressed for the day becomes increasingly difficult, and eventually they may stay in bed most of the time. This excessive sleeping serves a purpose. The body is conserving energy for essential functions. It is a protective mechanism. Sleep also provides an escape from discomfort, pain, or the emotional weight of dying. You might also notice changes in their sleep patterns, more confusion, between day and night restlessness, or what's called terminal restlessness, where they seem agitated even while sleeping. What families often struggle with. You want to spend time with them, to talk, to connect, but they're always sleeping. You might feel guilty letting them sleep, worried you're missing your last chances to be together. Here's the truth. Sleep is what their body needs. Waking them repeatedly to spend time together can actually cause distress and exhaustion. Better approaches. Adjust your expectations for visits. Sit beside them while they sleep. Play soft music they loved. Read aloud even if they seem asleep. Hearing is often the last sense to go, and they may be aware of your presence. When they do have wakeful moments, be ready to treasure them, even if they're brief. Quality matters more than quantity. Talk to their healthcare provider about whether pain or discomfort might be contributing to changes in sleep patterns. Proper pain management can improve their rest quality. Sign 4. Decline in personal hygiene and self-care. The fourth sign is a noticeable decline in personal hygiene and self-care. Someone who was always well-groomed might stop bathing regularly. They wear the same clothes multiple days in a row. They stop caring about their appearance in ways that would have bothered them before. Women who always wore makeup stop wearing it. Men who shaved daily let their facial hair grow. Hair goes uncombed. Teeth might not get brushed. Their living space, which they once kept tidy, becomes cluttered or dirty. This decline happens for several interconnected reasons. Physical weakness makes bathing and grooming exhausting. Cognitive changes affect their awareness of hygiene needs. Depression, which is common at end of life, reduces motivation for self-care. And perhaps most significantly, vanity and social concerns naturally diminish when someone is focused on simply getting through each day. For families, this can be heartbreaking. The person you knew as dignified and put together seems to have given up. You might feel embarrassed when visitors come. You might not know how to help without making them feel worse. Here's how to approach this with grace. Offer help without judgment. Mom, would you like me to help you wash your hair? I could make it feel really nice. Make hygiene comfortable. Warm towels. Gentle soap, no rushing. Break tasks into smaller steps. If a full bath is too much, a warm washcloth bath in bed might work. Focus on comfort and dignity, not perfection. Sometimes accepting help with intimate care is difficult for seniors. They may refuse because it feels humiliating. Be patient, be kind. Explain that you want to help them feel comfortable, not to criticize. And remember, their worth isn't tied to how they look. Your loved one is still the same person, deserving of respect and gentleness. Sign 5. Reminiscing and life review. The fifth sign is an increase in reminiscing and what psychologists call life review. Your loved one might start telling the same stories from their past repeatedly, especially stories from childhood or significant life events. They talk about people who have already died as if they're still present, or mention wanting to go home even when they are home. They might ask to see old photographs and spend hours looking through them. They want to reconnect with people from their past, old friends, distant relatives, even people they haven't spoken to in years. They express concern about unfinished business or unresolved conflicts. This life review is actually a healthy psychological process. They're making sense of their life, finding meaning in their story, seeking closure. It's their way of preparing emotionally and spiritually for death. Some seniors become more spiritual or religious in this time, even if they weren't before. Others might have visits or visions of deceased loved ones. Before you dismiss this as confusion, understand that these experiences are common at end of life and often bring comfort. You might also hear them say things like, "I'm ready to go," or "I'm tired of fighting." These aren't necessarily expressions of depression. They may be genuine acceptance of what's coming. How to support them through this. Listen to the stories, even if you've heard them before. Look at the photos with them. Help them make connections with people who matter to them. If there are relationships that need mending, facilitate those conversations gently. Ask meaningful questions. What are you most proud of in your life? What do you want your grandchildren to know about you? Is there anything you need to say or do? These conversations can be profound gifts for them and for you. They're sharing their legacy. They're saying goodbye in the way they're able to. Honor that. Important notes. Before we close, some important points. First, these signs don't follow a strict timeline. Some people show these signs for many months before death. Others decline more rapidly. Every person's journey is unique. Second, the presence of these signs doesn't mean medical care should stop. It means care should shift toward comfort. This is when hospice services can be incredibly valuable. They focus on quality of life, pain management, and supporting both the patient and family. Third, please talk to healthcare providers. If you're seeing multiple signs, ask about prognosis, about palliative care options, about what to expect. Doctors can't predict exact timelines, but they can help you understand what's happening and how to prepare. Finally, don't let awareness of these signs rob you of presence. Yes, the end may be approaching, but there's still time for love, for connection, for comfort. Some of the most meaningful moments happen in these final chapters. Recognizing these 5 signs: social withdrawal, appetite and weight changes, increased sleeping, decline in self-care, and life review, can help you provide better care and make the most of the time remaining. This isn't easy knowledge to carry, but it's important knowledge. It allows you to shift from curative thinking to comfort thinking. It helps you ask the right questions and seek the right support. Most importantly, it helps you be truly present instead of being caught off guard. Your loved one needs your compassion, your patience, and your love. You're doing something incredibly difficult and incredibly important by caring for them. Be gentle with yourself too.